and I'll ask you to introduce yourself as well. So good afternoon, everyone, and thank you for joining this lunchtime session on careers in public health. My name is Muna Abdelaziz, and I'm the Director of Public Health for Salford, where I lead on behalf of Directors of Public Health across Greater Manchester on workforce development. I'm so grateful for the steering group for workforce development in Greater Manchester, who have been meeting over the last 18 months, really, and we'd like to present some of our work to you today. So today we've got speakers who'll introduce themselves just ahead of the spotlight that they will share. And I'd encourage you as the audience to drop any questions you might have in the chat at the end of the session, and we'll get a chance to answer those questions on the speakers Q&A. As you listen, we want you to think about what this may mean for you in your own career journey and the topics that you may want us to cover in future webinars. So today we will be talking about public health, what it is, who are people who work in public health despite not having public health in their job description. And we'd want to look at the way we're working in partnership with our higher education institutions around population health and workforce development. So first I'd ask Mark to introduce yourself and your role, and then we will kind of like head into the webinar. So Mark.
Thanks, Muna. Very briefly, my name's Mark Brown. I'm a Programme Manager working for NHS Greater Manchester Integrated Care, and I support the 10 public health directors from the 10 local authorities across Greater Manchester on a variety of different programmes, one of which is public health workforce development, which we're going to be covering today. I won't take any more time and I'll bring the slides up, but just to say my contact details are at the back end of this slide deck that we've got here, and I'll put my email in the chat if people have any questions which aren't answered today or would like to follow up. Feel free to get in touch with me and I can contact speakers on your behalf. So I'll hand back and I'll bring up the first slide, Muna, for you.
Thank you. Thanks, Mark. So public health is defined by the Faculty of Public Health as the science and art of promoting and protecting health and well-being, preventing illness and prolonging life through organized efforts of society. Public health is about helping people to stay healthy and to protect them from threats to their health, as you've seen during the pandemic. Sometimes public health activities involve us helping individuals, but in other times it's about us looking at the group of a community or a geographical area, the health of many people. A wide variety of people from different professions have an interest in public health and are working together to improve public health. This includes people who have public health as part of their job description, like public health specialists, practitioners, directors of public health, and so on. It also includes the wider workforce, people in the public sector, voluntary sector who work with people and communities. Today's webinar is just a glimpse into part of workforce development for public health, and we will include several short presentations. The first will be an overview of the public health workforce, both specialist and wider, and the career paths that may be available to people who wish to develop their knowledge and skills in public health. That overview will be presented by Amy Stimpson, who gives her apologies, but has actually recorded a video, which is really, really interesting that we will watch together. After that, we'll look at the role of higher education institutions, and we will specifically look at apprenticeships and a case study of how colleagues are making the apprenticeships work for them in their careers and in the jobs that they're doing now. So Mark, are we ready to welcome Amy Stimpson's video? If we can play it with sound. Over to you, Mark. Thank you.
Hello everyone, sorry I can't be with you today. I'm Amy Stimpson, Deputy Director for Health Improvement at Department of Health and Social Care. More on that a bit later on today. As you may know, public health is a multidisciplinary career. Public health brings together medics and non-medical specialists as part of the public health workforce. Outside of those of us that are professionally trained, there are a wider public health workforce as well. Today, I've been asked to share my journey into public health as a non-medic public health specialist. So this slide shows my career path over time from the 1990s through to today. It shows the organisations I've worked in, some of which are public sector, some which are NHS, and it also shows my qualifications at the bottom of the slide and how I've continued with my qualifications over time. So you'll see I started my career in the 1990s and I found public health or the NHS in 2008. And then in 2013, we transferred public health from the NHS into the county council at the time. And you'll see I've held a number of public health roles in those two organisations, both as a business manager, then moving into a public health intelligence role, and then working my way up to Associate Director of Public Health, where I led on the Joint Strategic Needs Assessment. While I was doing this, I was studying for my master's as well, so really doing that on-the-job learning. Then in 2014, I decided to move across into a regional system, or regional part of the system, and I worked in Public Health England, firstly in the healthcare public health arena of public health. Then I took up a national role where I headed up the Healthy Places team. And then I gained my public health registration through UKPHR and was able to then take up my first consultant in public health post in 2020. And then in 2021, Public Health England was closed, and so we were moved into the Department of Health and Social Care. I've held a couple of roles in this organisation, and I'm currently, as I said before, the Deputy Director for Health Improvement in the North West. That also includes a remit for workforce development across the North West. I do have a number of voluntary roles which aren't included on the slide. So I do work for UKPHR as a verifier and assessor for people pursuing both the practitioner and the specialist route to registration. And I also sit on the Registration Appointments Committee at UKPHR. Last summer, I took up the role of Assistant Registrar at the Faculty of Public Health, so linking that back to my day job in terms of the wider public health workforce and the specialist workforce that we'll talk about later on. So I hope this just shows my personal journey as a multidisciplinary route into public health. So it's really important to remember that not everybody starts out in public health from their first job. So what do we mean by public health workforce? That's not easy to define, but I think the takeaway message from this is public health is everybody's business. Those of us working in public health will often talk about the core public health workforce, and that's shown in the bottom left hand of this slide. So those of us who have done specialist training. We may be working as heads of public health, consultants in public health, directors of public health. And they may be working in a local authority system, they may be working in the NHS, they might be working in the civil service. So that's the core public health workforce. But as you can see on this slide here, there is a much bigger part of the public health workforce. People who are working in the NHS, both as GPs, practice staff, dental staff, district nurses, the list goes on. They're all part of the wider public health workforce because what they're doing leads to individuals' health and well-being and improving health outcomes. There are people working in local authorities who are part of the wider public health workforce that you might not immediately associate yourself as part of this public health workforce, whether that's elected members, people working in leisure services, social workers, licensing and teachers. All of these people are also involved in individuals' health and well-being. Then you've got the role of the charities, voluntary sectors as well, as shown on the bottom right-hand slide of this. You've got various other people in blue light services who are going into people's homes, involved with individuals from a criminal justice perspective, community safety perspective, looking after the frail and elderly as well, as also people working in prisons deal with health and wellbeing issues as well. So this hopefully starts to illustrate to you what we mean by the public health workforce, and hopefully sat where you are today, whichever part of the system and organisation you are in, you can start to see yourself as being part of the wider public health workforce. And I think regardless of which part of the system that you're working in, there are common themes around this in some of the challenges about recruiting and retaining people into the public health workforce. And also how we identify as a public health workforce as well, because we are so dispersed. And I think, again, my last point on this slide is just the fact that there are multidisciplinary routes into it and different levels of people working. Not everybody will want to be a director of public health, and that's okay. And people may have specialised in medical training previously, but others like myself may be non-medics. And, you know, everybody is contributing to individuals' health and well-being, and not everybody has to reach the most senior levels of the profession that we work in. So just moving into my last slide, I've talked about a number of different organisations on the previous slide here, and I've also shown through my first slide with my career journey, the public health system, the NHS, we've been through lots of different reorganisations. So what this slide tries to summarise is the current national, regional and local public health system. So each of these different boxes will have public health workforce people working within it at different levels of, as I've just talked about. So taking the top row of this slide here is the local part of the system. So there are public health workforce in local government. There are also public health workforces within the integrated care boards and the integrated care partnerships. And public health in those parts of the public health system will more commonly be referred to as population health. And then moving to the second row on that slide, you start to see both the regional and the national public health systems. So from left to right, you've got the Office for Health Improvement and Disparities. That's the bit of the system that I'm currently working in and is part of the Department of Health and Social Care, so part of the civil service. We lead on health improvement, we're working across government, we are the interface between national, regional and local, and we have a real role in providing evidence, data and intelligence, and also in developing strategy and revisions to current strategy. The middle block is UK HSA. You might be wondering what that is. It's the UK Health Security Agency. So in public health terms, that's the health protection part of the public health system. So that was created when Public Health England was closed, and the functions of Public Health England went into these three regional organisations. Within UK HSA, you've also got emergency planning. So obviously things like the pandemic and other responsibilities will sit there. And then on the right hand side, you'll have a public health workforce in the NHS. This again can be different parts of the NHS, but regionally and nationally as well. And you will find some of the services and functions of NHS England include health and justice, immunisation and screening, dental public health, population health, health inequalities, and something called specialist commissioning. So that hopefully provides you with a landscape of the current public health system, and you can see that wherever you are, if you are working in public health, you could be in different parts of the organisation, but you're integral to how we can improve the health and well-being of our population. This is obviously at a point in time, and this slide doesn't show other public health agencies who are involved in our regulation, such as UK PHR, and also organisations that support local authorities, such as the Association of Directors of Public Health. And then you've got societies such as the Royal Society of Public Health, who focus on and provide support to the wider public health workforce. Those do exist. We haven't got time to go into all of those today, but hopefully this slide just summarises the public health system as we stand today. I hope you have a great rest of the day, and if you've got any questions, do get in touch with Mark, who'll be able to contact me. Thank you.
That's great. That's great. Thanks to Amy. It was great to have that simple understanding of quite a complex system. So what is it that we're trying to achieve? A group of us got together around Greater Manchester Workforce Development, and we realised that there are so many resources out there around public health that people could tap into, freely available, but we didn't know what each part of the system had to offer. So we brought all of that together and summarised our ambition in terms of creating developing a talent pipeline for public health practitioners, develop routes into specialist public health roles, to provide continuing professional development, and to build system leadership capacity and capability. Now, clearly, a 1-hour webinar is not going to be able to cover all of that. So we've chosen this very first session to focus on apprenticeships and the range of opportunities that we know exist, and maybe it's the best kept secret apprenticeships because they can be viewed as skills escalators to fast track your career. So our first speaker on this will be Helen Hickson. So Helen, introduce yourself, your role for University of Bolton, and take us through your presentation. Over to you. Thank you.
Thank you, Muna. Yes, so my name is Helen Higginson. I'm the School Apprenticeship Manager at the University of Bolton, and that's in the School of Health and Society. We have various different schools offering various different apprenticeships, but I am above the Health and Society school, so I'll go into more detail about the apprenticeships that we offer in a minute. And just a bit like a radio advert with product placements, although I'm doing this, there are other universities available that offer different apprenticeships. So just to get that out there at the offset. So you can go on to the next slide, please, Mark, and the next one after that. So what is an apprenticeship and who are they for? So basically, for anyone of working age 16 and upwards, there is a variety of levels that apprenticeships work from, so from a level 2 up to a level 7. And the beauty of apprenticeships is, as I've put there, it's earn as you learn. So at the moment, our youngest apprenticeship at the University of Bolton is 18, and our more mature apprenticeship is age 56. Apprentice, I should say, is age 56. So with this, you know, they are for everybody. They can be for everybody. They're not just from the straight from school, which is often a misconception with apprenticeships. And the beauty that we get that vast variety of age groups is that people are coming with a great lived-in experience that comes to the apprenticeship. And the other beauty of apprenticeships is it's, you know, you are learning on the job, real world, real time. So unlike a direct entry apprenticeship, unlike a direct entry apprenticeship, you are learning and gaining all those skills throughout your programme. The other thing with apprenticeships is they have to be, the offers have changed slightly. We just do a minimum now of 6 hours per week. That has to be the off-the-job learning, so that might be your day at university or it might be a half day at college. And depending on the level you're doing as an apprenticeship, they can take anywhere between 12 months and 5 years to complete. Next slide, please, Mark. So as I did mention, intermediate level is the lower level of the apprenticeships, but obviously, like Muna's just said, a skills escalator, a stepping stone for many. The ones that we tend to do at university start from the higher apprenticeship and they're equivalent of like a foundation degree, and they will be your level 5 and upwards. Next slide, please. So there is various routes to gaining an apprenticeship, and these are the main ones are the levy funded, non-levy funded or co-investment, and the independent route. And whilst I put the independent route on there, what can happen in workforce planning is that apprenticeships can be quite competitive to get into, and if you've got, you know, one offer of an apprentice route within work, you might have 5 people who go for it. And some of those might decide they want to do that apprenticeship route, but as a direct entry. So most apprenticeships have a direct entry route as well, just as a normal university student would pay the university fees. And apologies for the spelling mistakes there on the, should be via rather than by. Next slide, please, Mark.
Have we frozen?
Oh, right, okay. So just a little bit more information about those levy and non-levy. So if you are a large organisation that's paying more than £3 million a year in a wage bill, you will automatically be paying into the government apprenticeship levy. And it's very much a use it or lose it. So whilst you are paying into that levy, if you don't use the levy for your apprenticeships, then that money is just lost. And there is a large amount of money, I think, in apprenticeship levies that is not being accessed. So there is the money there. In terms of some apprenticeship incentives, there are £1,000 for additional apprentices that are at age 16 to 18 years, any age 19 to 25 that have had education or health and care plan in place, and 19 to 25-year-olds who used to be in care. So there's additional incentives there to having apprenticeships within your workplace. So that's levy, you will automatically be paying in. Non-levy is for those organisations who have a wage bill less than £3 million. And with this, the government will pay 95% of the cost of the apprenticeship, so the fees, and then the individual organisation will pay the additional 5% contribution. So that's a great way that smaller organisations can tap into bigger organisations. So, for example, you might have a private residential and nursing home that's got a very small wage bill in comparison to the National Health Service. So they might tap in and ask, can we have some of your levy, please? And that levy can be transferred over to that smaller organisation. And that's what's called a matchmaking service. So that's all on the government website. So places like voluntary organisations can all tap into that wider levy funding. So there is additional funding out there. Next slide, please, Mark. So the benefits of hiring an apprenticeship, we're not saying apprenticeships are the be all and end all in terms of, the funding provides the cost to for the education side of things. It's not costing the wage bill. It's not the wage bill for their apprenticeship. So they are a great skills escalator. They are great for progression. But obviously that all comes in that workforce development and the planning of what do you need within your teams, and what levels can they work at, and obviously the cost that's involved in having those staff different opportunities, sort of thing. So it is a truly effective way to grow your own talent. So apprenticeships, because they are that maybe one day a week in university, the rest of the time is with the workplace. And you're learning from those people who have been doing the job for a while. You're learning those skills that are key to your workforce area. You're gaining all that additional knowledge, like I said before, real world, real time. It's great in terms of improving productivity. So what we like to think of apprenticeships do on that skills escalator are you're learning from those that are already doing the job maybe at a higher rate, a higher level professionally than yourselves, but you are learning that job in that team. Retention rates tend to be better with apprenticeships because apprentices feel that you have invested in them. You've set them on that academic programme, you've set them to progress on their career. So quite often apprentices will stay within your team, not forever, but they often are that, right, you've invested in me, so I will invest back and give you my time back in terms of staying with you. So there's not a quick turnover as we see in a lot of areas. And obviously with that, you've got that employee satisfaction. You've set them on a pathway to progression. It can reduce costs if you go to the internal progression routes and instead of going out to advert widely, you can do it as internal expressions of interest, so that it's cost cutting in those areas as well. And like I said, you are tailor making your individuals because they are with you for the length of their programme. So all the skills they're learning are directly integrated and implemented within your workforce and what your areas need. Next slide, please, Mark. So entry requirements, all universities I think will do this. We all consider individuals because you can have an absolutely fantastic member of staff but hasn't got the academic qualifications maybe they thought you needed to access an apprenticeship or certainly access university. So we're trying to get rid of those stereotypical university, I can't go sort of thing. But one thing that all apprentices need to have an achievement rating is maths and English. So unless you have your maths and English by the end of your apprenticeship, you cannot achieve. It's a real complex area, this. And what we would say is anybody considering having an apprentice, go out to job adverts, start those discussions early. If that individual, it's maybe 20 years since they've been in any sort of academia and they've not got the maths and English, then get them on a programme now. Suggest they go to the local college, look where maths and English is being done for free. There is a lot of areas that do maths and English free and a lot of funding that can be tapped into. And maths is a real stumbling block for many, myself included, in that, but it's something that has to be achieved. And from a university perspective, we're definitely not wanting to set anybody up to fail. So we need to make sure that somebody is going to achieve that maths throughout. And it's an awful lot to do if somebody comes on programme without maths, but it's not unachievable. It's just a lot of work that has to be recognised at the outset. Next slide, please, Mark. So the direct apprenticeships that we offer at the University of Bolton that are directly linked to public health are the assistant practitioner, which is the level 5, so the equivalent to the foundation degree. The assistant practitioner programme is 2 years, and with this, although it's the generic title it can have on, assistant practitioner in dermatology, assistant practitioner, specialist occupational therapy, you can add on your specialism at the end. So we already have a public health pathway in this programme, and that's where things like specific modules will be studied, such like introduction to public health, social inclusion and empowerment, understanding substance and alcohol misuse. But everything that is done in university is tied back into the workplace. So that's where that earn as you learn, real world, real time things comes in. It's not your day at university, then go off and produce a 2,000-word essay. It's your day at university, put that theory into practice throughout your working week. The other one that we've got is we are starting the public health practitioner, which is your degree level 6. So we've not got a date yet as to start that, but that is imminent. And we've also got the public health masters programme that is starting imminently as well. So those are 3 specifics. Next slide, please, Mark. In terms of additional ones, with our School of Health and Society, everything we do really has a public health influence on it. Just like Amy was saying before, because we have nurses, we have dental, we have that wider public health arena. So we have the social work degree, we have community development and workforce degree, health and social care management, and the senior leader in health and social care. So all these programmes, being health and social care, have a certain amount of that protection, prevention, promotion key to public health. Next slide, please, Mark. So these are just some wider apprenticeship routes that we also do at the university. Just of interest, really. And like I said, the things like nursing associate, advanced clinical practice, occupational therapy that's coming on soon, dental technology, operating department practitioner, all link in with that public health, although may not have public health in the title. Next slide, please, Mark. And this is just a little bit about apprenticeships. We tend to do and offer a wide variety of assessments, so it gives everybody to shine. Somebody at age 18 might be brilliant at writing an essay, but they're not great at presenting to their peers, where somebody with that lived-in experience at age 30, age 40, age 50, it doesn't matter, might be more comfortable doing a presentation. So we try to offer a wide variety of assessments within our apprenticeships. Obviously, they have to withhold that academic rigour. They have to be, you are at university, you are studying for a degree or a foundation degree. So they have to come with those, those academic standards, but it's just a chance to say that we do a wide variety of assessments to give everyone a chance to shine within their apprenticeship. Next slide, please, Mark. So in terms of entry requirements into apprenticeships, they will differ depending on which programme you are interested in, which programme your workforce are planning on doing. So what I would say is always check, with the apprenticeship, what is the entry requirements for it? What does the off-the-job, the on-the-job look like? What does your workforce planning want in terms of an apprentice? And then go to the individual university, look on their website to see, how many days a week is it in university, what day is it on, etc., etc. Then you can start, planning and looking at the individual criteria for those different apprenticeships. Some will be 2 years, some will be 3 years, some might be 18 months. but it's always worth checking. And where you might find general requirements, so some programs might say, you know, a minimum of 4 to 6 GCSEs or 4 or 5 GCSEs. It's always worth going directly to the university, because like I said before, in terms of widening participation, we would look at experience. So you might not have 4 GCSEs at grade C and above, but you've got 10 years experience in public health, which for me, you know, is almost better than having that academic 4 GCSE. So we will always look at individual criteria. Next slide, please, Mark. So every apprenticeship, no matter what level, will have certain compliance, which is things like the on-the-job and the off-the-job training. So off-the-job is, in short, everything that you do is new learning. So your day at university or college, and then any new learning you do within the workplace. On the job is your general working hours. So when you're doing something and it's just part of your day job and it's no longer new learning. But every apprenticeship will have an element of on the job and off the job. As I've said before, the beauty of apprenticeships is the learning is all within your team for most programmes within public health that we offer. So things like nursing are slightly different because you'll go around the 4 areas of nursing. So you'll go off and do spoke placements. With the assistant practitioner and potentially the public health programme, you are maintained within your team, so you absolutely grow within your own team. You are always an accountable practitioner. You're always working within those individual codes of practice and policies and procedures that we'd expect, but you're also an autonomous practitioner, so having those delegated tasks, having your own service user clients that you work with. And it's always looking at that's, as Muna mentioned, the skills escalator. What can that, you know, the public health practitioner delegate down to the lower apprenticeships to free those up to do the job that they need to do. Applications. This is just a brief overview in terms of, obviously, applications. It's about expressions of interest, looking at about what your team have in terms of workforce planning and where those apprenticeship opportunities might be coming up. As I mentioned before, check the qualifications, check your entry requirements, check with the university what is available. And then the next slide, please. For me, for those of you who may be on the call and are interested in a career with public health, it's about, you know, when you have your appraisals, talking to your managers, talking to your teams, what opportunities are available. Be proactive, start looking yourself about what apprenticeships are linked to public health, going to your team leaders, going to your managers saying, I've looked at this, would this fit? Is this something we can develop? Is there progression routes there? And, you know, get things documented in appraisals. And in terms of where, I think somebody put on the chat before, in terms of where you can find apprenticeships, NHS job sites, social care job sites, council websites, the general government website. So gov.co.uk has a dedicated apprenticeship website where you can look, you know, which universities, which colleges offer which apprenticeships, and where there may be apprenticeship opportunities already available. They will post lots of jobs. And I think that's it from me. The last slide is just about the University of Bolton, and as I said, there are other universities available. So thank you for listening, and any questions I will endeavour to answer either in the chat as we're going along now, or I think we're going to feed them out after. So I will hand back to yourself, Muna.
Thank you. Thanks, Helen. So yes, we're really grateful for your contribution in terms of higher education institutions working with us to develop the talent and using the skills escalators. We've got a case study and some personal experience, haven't we, Lee? We're really pleased that you could join us today. If you take us through your slides, and we appreciate the fact that you had to jump in from a different meeting. But over to you, Lee. Introduce yourself, your role, and tell us more.
Absolutely. Good afternoon. We're on afternoon. We are on afternoon. Good afternoon, everyone. My name's Lee Buggy. I'm a public health specialist for Live Well and Healthy Place. I work within Bury Council's public health team. Thank you, Mark. Next slide, You there? Is it moving? Thank you. So just to kick us off, and it's a wonderful segue from what Helen basically did there and said there around the academic pathway and route through the practitioner degree. Myself and a colleague within Bury's public health team both managed to go through the first pathway or the first cohort to qualify and obtain our degrees in December last year. Graduation's now looming in terms of June. So we were the first cohort to go through the public health practitioner degree. Whilst it brought many challenges, I think it also brought a magnitude and myriad of opportunities. Hand on heart at the time when I was going through that particular process and working for operations and leisure services, did I see the connect? Probably not. As I moved into a public health role, which I'll touch on in the next couple of slides, the synergy between the taught academic pieces and the modules, the knowledges, the skills and behaviours, I started to pull them through into my work. So it felt a little bit more real, felt I could operationally get my hands on things and start to action things. Whereas in the old role with leisure and operational services, it was more difficult to kind of action those. But I can see it through both lenses, that if you're working in a different environment and a different feel and want to make that change and that move, then absolutely it gives you the skills to do that. But otherwise, obviously, if you're working in public health, it gives you additional tools to be able to do this piece of work. Long journey. I started as a professional footballer. That's me on the right hand side back in the day. So my academic experience, I would say poor. I'm going to say poor. I hadn't done much in terms of learning since I was probably late 20s. I'm now in my 40s. So going back into an academic environment, as Helen's just said, was pretty daunting. I found that quite a challenge, and going back in and feeling probably out of place at my age at the start of the degree. What it did, though, it kind of catapulted me through a career in the leisure industry and through operational services. I became the commissioner for the Sport England project, started working on national diabetes prevention programs, started working on weight management programs, and kind of thought, you know what? I'm doing a lot of public health type roles over in another different department, and fancied a move into public health to become kind of that strategic lead or commissioning type role, whereas previously I was operationally delivering services that have been funded or resourced by public health. So that's the green arrow in the middle that kind of puts you through that. I've got a taste of Prince 2 and project management and kind of line management, which I'll touch on in the next slide. And again, that kind of whetted my appetite ever so slightly. So when the opportunity landed to onboard on the degree, which was during the pandemic, I might add. So again, an additional challenge doing it as a blended learning set. So doing half online and, you know, now and again we were going in, etc. was a difficult piece, but obviously people won't have that, or new applicants won't have that particular challenge to go through. Kind of learnt from my work as humanitarian aid lead, distributing food parcels and food packages, medication within the pandemic, and kind of thought, I like the health protection side now of public health, and kind of got me interested in vaccinations and the health protect. But I was always more towards the health promotional side. So I probably put more in terms of those modules. As a result of the degree, managed to secure a role in public health. So I'm the public health specialist, as mentioned. My team kind of touches on multiple commissions, live well services, substance misuse, mental health, physical activity, obesity, all comes under my kind of remit. And the next slide should segue that in perfectly. And again, sorry for me rushing, but I'm aware of time. So that's what our structure looks like. And I kind of challenge some of the words within this structure. And again, I perceive these to be a barrier for people getting into public health careers. So I challenged what a public health specialist was. I didn't see what that was. I challenged what a public health consultant was. Is that someone we bring in from an external company? So when I was in my old role, I kind of thought, do we bring in someone external, a registrar? Where do they fit? Are they lower or higher than a practitioner? So I couldn't get my head around how these fit. Mark's some move now, by the way, so if you just click for me. So my role within the structure, the public health practitioner who did the degree with me is in my Live Well team. So Jim McGlynn's my mental health practitioner. That's the strand of the area of public health I work in. So there's 3 specialists: Start Well, Live Well and Age Well. So I pick up on the Live Well element of that particular role. Managed to secure that through the degree, and a caveat of securing that role was you need to finish your degree to be able to operate in that capacity, you know, at a senior level within the public health structure, which I fully accept. And you know, that was a caveat before taking on that role. Not a huge public health team, but the crossover I quite like in terms of health protection, health promotion, has a real good feel across the life course. I'm particularly interested in aging well as well from my old role. So a lovely structure in terms of how it works, etc. And the delegation to my team, loads of interesting things, never change, never a dull day, so to speak. Mark, next slide. That should segue me nicely into the management and leadership elements of the or modules within the public health practitioner degree. Traditionally, I'd line managed teams of people. When I did the module around leadership, I quickly realized they were two very different things. I think that the key bit I gain from the management side was emotionally distanced, and then the leadership side was emotionally connected, and then the different styles of leadership as well. So around systems leadership, we're all going through transformation and change, and then sensitivity in terms of our leadership. I thought they were excellent pieces within that particular module, and something now I consider before I do line management is around my leadership style. So hopefully that comes across with my team. And I've just put a bit of advocacy, because it's not just leadership or management within my team or that structure. This is one that landed 2 weeks ago from a counsellor within the area as well, so not my particular team. Just thanking me for representing the voice of a particular area in Bury around vaccinations. It was her daughter who couldn't get to weekend and evening, or she could get to weekend and evening vaccination slots, couldn't make it in the day. So it was about taking on that particular ask, going through the right channels, and making sure obviously we were getting the right outcomes from that. I won't give you the outcome as part of this due to time, but there has been an outcome as part of this. So whilst it wasn't my world, I think that the leadership and advocacy and influence that you can have at a particular level after doing the degree does hold some significant weight. Mark? Seamless plug on the right hand side. So we've got Man versus Fat coming into Bury, but don't worry about that. It's just a nice colourful piece. It's not what the slides are about. I'm just going to take you through kind of a menu of academic learning that I've gone through since that through passing the degree. So I'm going to touch on policy and strategy. I'm going to tease out some information around leadership, management and health economics, which was really interesting around quality of life. That was seriously interesting rather than just wet finger in the air around what we're saving in GP or healthcare practitioner time. Partnership, working in collaboration should be a key thread around everything we kind of do. And I'll go through some complex mental health mapping and creating active schools piece that we've done. And then research and evidence and hierarchy of evidence with the Swap to Stop pilot we're doing with Primary Care Foundation Trust. So that's where I am at the moment. I'm at Radcliffe Football Club, which is in Bury. I've just I've managed to get a range of partners around the table this morning to contribute to a physical activity refresh, or the Bury Moving Refresh, that focuses on those key objectives that are in red, and then a myriad of actions at the bottom end. Having the underpinning knowledge from now the degree and confidence to, I suppose, question whether this strategy was still fit for purpose given the pandemic, given some strategies and policies that have landed since that particular strategy. I've been able to pull together a range of partners this morning to tease out next steps, which I think has been super useful. But understanding the difference between a strategy and a policy before doing the degree, I just would have thought they were one in the same thing. But now understanding which has line of sight to potential senior leadership, which ones have the ones that have an action plan. How do we design an action plan? Do we use Gantt charts? Do we use, different tools that I've drawn from my university experience? So all this has come from taught learning. It's being applied now, but very much from taught learning. Mark? So this is an interesting one around active travel. If you're from Greater Manchester or work in Greater Manchester, you'll be aware of the B Network and the MERS Challenge Fund. This is a piece that we've managed to collaborate with a multitude of partners. We've got a school, I actually went to that school, which is St Gabriel's High in the bottom left-hand corner. So we're considering the life course approach and what research and evidence tells us, and using a hierarchy of evidence along with grey literature and anecdotal pieces. So this has been super useful. We've engaged primary schools, so we've looked at our national child measurement data, and we've understood that some key areas, while suffering with inequalities, have higher rates of childhood obesity and children that are overweight. So we've done a particular thing around road traffic calming and 15-minute neighbourhoods. It's been super useful. We've also done, and I'll finish on this slide with this one, we've also done a range of floor markers, and we're thinking about health messaging and literacy. We've had to go in now, top of my head, I think Bury's health literacy, we're at 42%. Obviously we're less than half of our general public really fully understand health literacy, so I had to think about how I design floor markers. So I've done them bright, I've done them in colours, I've done them in Urdu and Yiddish to benefit some of our communities as well after that community engagement piece. So really using these skills and drawing them into how I'm being a public health specialist and tying into our communities, very much around consultation with our communities as well. So we've gone out and we've done road shows, the middle section through the northern through National Cycling Academy, done a load of consultation in and around these communities to understand really what they want. We've done that via multiple methods, given people's access to digital platforms, etc. Mark. Oh, the health promotion planning cycle. So this was embedded in many a university assignment. Two key areas I've just teased out for the purpose of this presentation was very much around setting aims and objectives. Before doing the degree, I was very much a bull in a china shop. But in terms of operationally delivering services, my public health commissioners would come to me and say, get things done. So in terms of setting aims and objectives, I would go at things rather than have a look at the monitoring and evaluation process, an iterative process of how that would look. I would just get things done by hook or by crook. I think what the academic underpinning now has said, Lee, take a step back. We've got cycles and we've got toolkits to work through that are evidence-based, that you should really be doing as best practice and as a public health practitioner. And then the obvious one for us around the table, and again, I don't know the range of audience bandwidth, was around identifying resources. I've just done this morning. We don't have any resources. We've got very finite resources. We've got limited resources. So how can we be innovative, creative, and use our communities to come up with solutions with very limited resources? So they were two key ones out of the yours and Simnett health promotion planning cycle that I've now adopted, whereas 10 years ago this wouldn't even been in my line of sight. Mark. Thank you, sir. In terms of a quick funding one, and I'll be super quick with this one, I've just worked through with my staff who were a bit of an underspend in some COVID recovery, very limited. All my staff wanted to do something. You saw the structure of my team before. There was 4 practitioners, all wanted to do something, all thought it'd be useful to do this with a particular community. I did ask them to go away, and this probably was more of my leadership style, to go away, provide the insight and evidence, monitoring and evaluation frameworks, understand the commissioning and procurement cycles, health economics that sat around that particular piece, and collaboration with our communities, not just commission services that we've always done because they're historically in and around and always give us the outcomes we've always got. So bringing that academic learning back to say, this is the process that we need to follow as a team, I think has stood us in good stead. We've done some stuff around suicide prevention, bereavement, physical activity, early years, etc. And again, I'm happy to share this post today with any on the call. Mark? That's the creative active schools mapping bit, and again, I won't dwell on this. This was very much around partnership working. It's around using an interactive tool to digitally map what primary schools are doing in and around our area, but working with school heads, providing that data around national child measurement, physical activity levels through Sport England, some of our health data. What does a 15-minute neighbourhood look like? What does safer streets look like? Are schools doing bikeability? If not, why not? Are schools doing swimming? So all that's mapped now on a digital piece. Again, before doing that, would I ever done a gap analysis or a mapping piece? Probably not. I'd have probably just divvied up the resource we had via school and gone into that school and said, this is how we can support you and why. So very much doing that piece beforehand. And I've just put on the right hand side there around improving partnership work and the ingredients for success, very much around focusing on outcomes for ourselves and partners, but leading by example is a big one for me as well. But there's a myriad of different ingredients which I took from it. Mark? And hopefully these are useful examples as we go through. So the swap to stop stuff, Mark, if you click a couple of times, it'll just bring up the data. This was just around me using now evidence-based tools and doing a deeper dive into literature reviews, using the hierarchy of evidence to say, well, if 11.7% of Bury's population are smoking, well, what's that 40.3% doing? And how are we tackling that in terms of inequalities across SMI cohorts? So we're now doing a swap to stop pilot with this particular cohort. Mark, the next piece will show what we did. So I'm using COM-B. For those on the call that aren't aware with behaviour change models, there's a myriad of different models. I could have chose the health belief model. I could have used Prosca and Di Clemente. We decided to use the COM-B model, but we used the COM-B model with our partners and those service users. So it was nice to get that feedback from our service users within those services to go through the COM-B model and find out what's the best way to do this. Obviously, with the National Swap to Stop provision landing now, we've got this, but this particular piece of work superseded it. So it was about bringing behaviour change models in, is where I'm going with it, what we hadn't done before. Mark, last two slides, and I'm aware of questions. So these were just tips for students. Again, I won't rattle through them. You can share the slides after it. Again, I wasn't sure of the audience, professionals or students. Very much around using, leaning on your mentor. My mentor's a consultant within public health and/or was. Create a WhatsApp group definitely worked for me when I was having my, I'm going to use the word dark days, when I was having my dark days across assignments, etc., for people to pick me up and say, no, you're going in the right direction, Lee. And then it was my colleague who's used the terminology. It's just like eating an elephant. It's piecemeal, just one step in front of the other, very much so for me. And then Mark, the last slide, just so thank you. And if you need to get in touch with me outside of this, I've just put my email on as well. Sorry. So this one was an ask of the GM workforce. So use the wealth of knowledge obtained from the practitioner degree. And I will, yep, perfect, Mark. It's fine. I'll take any questions via email after this, and I'll have to leave this venue if that's all right. Sorry.
Thank you. Thanks, Lee. No, that's amazing. Really good representation of how beneficial an apprenticeship is, and a degree apprenticeship, all this work over 3 years. It took place in University of Salford, but we've heard University of Bolton will be bringing in that degree apprenticeship. We've got a few questions. I'd like to bring Helen in, and then I might, as Lee's had to leave, I would like Neelam to introduce herself as well for this speaker bit of a Q&A. Mark, you might also want to chip in as well. Very quickly, questions in the chat. How do young people apply for apprenticeships in localities, as there doesn't seem to be anything on government websites? Is that, Helen, something that you've would like to just give a quick answer on?
Yeah, I think it's a little bit like I said before. So if it's not on the government's website, it's like looking on council websites, NHS websites, job centres. Everyone who's got an apprenticeship available will be on that. And although the government website might not be advertising the job, the government website will tell you. If, say, for your example, you're looking for an apprenticeship in engineering, totally not with public health, but that government website will tell you every workforce that has supported an apprenticeship through an engineering, and what the companies are, where they're based, and what colleges they use and things like that. So it is a good link. But looking at GM access portals and things like that, where to look at what jobs might be available, and whatever platforms, Moona, I don't know whether you have a job platform like the NHS has a job platform. I'm not sure about that.
Yes, so it's a real good project, because we don't actually advertise apprenticeships per se. We just advertise jobs. Sometimes the job description doesn't even offer a development opportunity as an apprenticeship. So what we're trying to do really in Greater Manchester is to grow our own people who are currently in jobs, being able to develop, learn and earn at the same time and grow. And the team benefits from that as well. Neelam, introduce your role for University of Salford. And then there's a question there about the degree versus a master's. So I can ask it after you introduce yourself.
Yeah, hi. So I'm Neelam Prinja. I'm Programme Leader for the Public Health Practitioner Degree Apprenticeship at the University of Salford. So Lee, who was speaking previously, he was one of our students on the Public Health Practitioner Degree Apprenticeship. And as he mentioned, he was one of the first cohort to graduate on this programme in the country, because it's a fairly new apprenticeship offer. I think he downplayed the success, because all 5 of that first group got promoted whilst they were going through the degree apprenticeship. So that was really great to see. I've got a couple of, sorry, go on.
Go for it. Go for it, Neelam.
Now, I was going to say, I'll just ask Anna Cooper-Ryan, who's the head of public health at Salford, to introduce herself as well. So we have an undergraduate degree apprenticeship and the Masters in Public Health at Salford University. So I don't know if you want to pick up the question before we say sort of much more. Conscious of your time.
Yes, absolutely. Because so we've seen Anna drop her note in the chat as well. So welcome, Anna. So the question really is, what's the difference between a public health degree at the end of an apprenticeship and someone who's just done a public health degree, whether it's a master's, for example, or a bachelor degree in sports and exercise? Because people finishing the degrees struggling to get jobs in the open market, and I think that's the issue. Whereas, so what's your experience like in terms of the Salford public health degree? We've got people very competent.
Yeah, so the public health practitioner degree apprenticeship. So Muna, you'll know some of this. You know, there's a trailblazer group that was set up when the whole degree apprenticeship was first designed. So it is a very new programme. At the moment, most of our apprentices, they come from the local authorities, the NHS, and we're starting to see some apprentices from the charity sector as well. Most of them at the moment are people that are employed in public health related roles, who are supported by their employer to be able to progress their career. So it's, as you mentioned, Buna, it's very much, it's been employers supporting progression and development of their existing workforce. So that's a big part of what we've seen. More we have seen, and it's a smaller number, of employers setting up new posts that are set up as apprenticeship opportunities, where they're advertising the roles for apprenticeships, totally new into public health, who get an opportunity to study and work in a public health practitioner role at the same time. I'm also on the Royal Society of Public Health board, and we have similar discussions there, you know, where they focus on the wider public health workforce, and some common questions come up, you know, how do I get into public health, whether I'm completely have no background in public health, or even if I've got, you know, a master's level qualification. So I think this work that's happening across the workforce in Greater Manchester is really needed and exciting, because there is so much interest. It's developing the pathways and making people aware of those pathways.
Absolutely, that's true. So we've got just a couple of minutes left. So I'll ask the same question to Helen, and then Mark, I'll pass on to you to conclude. So Helen, what's the difference between a qualification that's kind of like brought just as a degree, whereas an apprenticeship is going through learning on the job? And so it's not just the financial side, is it? It's actually the end. You've got more career opportunities because you've been learning on the job, as opposed to trying to break into a job opportunity.
Absolutely, and you've learned tailored to that actual team. So it's like I said, it's you've got all those real world experiences, unlike a direct entry student that's maybe spent 3 years at university and then just put that theory and then started on a job. The apprenticeship route, you are learning consistently. And as Lee mentioned, apprenticeships are all about knowledge, skills and behaviours. So every apprenticeship has its own set of knowledge, skills and behaviours. The knowledge is what's taught at university. The skills are then put into practice in the workplace. And generally, you will always have a mentor who is signing you off throughout that programme as a competent practitioner in that skill base. So you gather all this knowledge, you gather all those skills, and then, you know, hopefully workforce planning is, if you have these knowledge and skills, then that's your progression route, because that's what we need for that level of qualification, or that's what we need for, you know, your consultant in public health. If you've got this in public health, then you're eligible to apply for that. But it is, for me, it's about just that learning on the job, learning from your colleagues. What does the job look like in real world time? Right from the word go, you're in there with clients, with service users, working within your community, and you're gaining all that valuable experience. you know, which you can't really quantify against a direct entry student who's just at university. So, you know, there's a place for both. There will always be a place for both. But they are, you know, great in terms of, you know, the cost of living crisis we've got at the moment. If you can get onto an apprenticeship, you know, you've not got that X amount of £1,000 that you're paying back in university fees. So, you know, they're an excellent route to getting the same academic qualifications.
It's a no-brainer. One of the
It is
things I
absolutely,
always
yeah.
say.
Yeah.
One of the things I always say, start where you are, use what you have. So for
Yeah.
example, you're an A&E nurse. Talk to your managers and see what public health work you can do while you're an A&E nurse, and really build up more of a public health experience. Go on an apprenticeship that's directly relevant to nursing as well as public health, and, you know, just build your career in the direction you want to take it.
Yeah.
Mark, how could people find out more then? Oh, I will bring in Bimpy as well after. So Mark, where can people find out more?
Yeah, thanks, Boona. I'll share some links with this slide deck, and people can have a browse through. I think it's acknowledged, and reading some of the comments in the chat and some of the things have been touched on already. I think naturally with any career, but what I picked up certainly within public health, the world of public health, to try to understand what career opportunities there are, what learning and development opportunities there are broadly. Today we've focused very much on apprenticeships, and we've heard from Lee and his experiences. And if we go back to Amy's earlier presentation, she touched on some of the other portfolio routes and some of the other opportunities and ways that you can progress a career in public health. And as you alluded to there, Moona, if you are working within the health and care workforces or within the voluntary community, what kind of CPD opportunity, what career development or CPD opportunities are there around specific public health topics or themes that you might be interested in? What we're trying to do, we haven't got it yet, but what we want to do is to have a single kind of landing page, and I'll pop a link in the chat so people can start to have a look at what's in development through what is being referred to as the Greater Manchester Fairer Health for All Academy, which is derived from the report that Michael Marmer produced a couple of years back, or a few years back, around how we need to build back fairer in Greater Manchester, how we need to do things differently. And part of that is an examination of our current workforce, the people who are helping and supporting people to live healthy lives. So we're utilising that site, and within that site currently there's a very small section on learning and development opportunities with links to University of Salford, links to University of Bolton, links to other CPD opportunities. So that's going to expand and grow. So sorry, I've gone on a little bit there, Moona, but so there will be links that I'll share. But watch this space, I think, for the Fairer Health for All Academy, because if I'm sure people are nodding like me, I just want to go to a single page where I can find out what the careers are, find out a little bit more about people like Lee, find out how much you get paid for doing a job in a particular field, you know, those kinds of things that you need to know. The NHS Careers site has some of that information already, so it might be a little bit of lifting some of that information into our site, but to kind of promote it really around Greater Manchester, we aim to do that in the future. Sorry, Bruno, went on far too long.
No, that's wonderful. All on record. Bimpy, final word, and then I'll close.
Yeah, thank you very much. I was just going to echo some of the things Mark has said, but I wouldn't say what he has said. So a lot of people are moving and transitioning into public health through relevant work experience in various fields. And I think we have a whole bunch of people in that category, some of whom are on the call today, who have not done the apprenticeship route. They've studied other backgrounds, nursing, medicine. They've studied the typical masters in public health, and they're stuck. They don't know how to progress further into becoming a public health practitioner or becoming a public health specialist. So that's another piece of work to do. That is there something, Mark mentioned it, if it's a CPD, if it's something that they need to do to become that practitioner, to become that specialist, or to pursue UK public health registration, what is it? That is where people who have pursued who have public health background are stuck in terms of where do I go to look for work? How do I achieve being a public health practitioner or a public health specialist? Because they're saying, okay, I don't think I need to go back and do the degree apprenticeship again. I understand everything that Lee demonstrated now. I know that I can do it, but why can't I be a practitioner? Why can't I be a specialist? There are lots of people who are in that gap now and who don't know how to proceed further.
Yes, maybe Amy just really did summarize it well when she reflected on her career journey as well as Lee. Some of those roles you take don't have public health on the title. They could be purely clinical, they could be purely managerial. So the point is, use what you have, start where you are. If you've got an employer, talk to them about your career intentions, how you may be able to do a little bit more public health style work, bring in some of those frameworks, bring in some of those skills and knowledge and behaviors into the job you're currently doing. And it could be in any sector. It doesn't even have to be in health and social care. So you can migrate into a public health role, one step at a time. The apprenticeship we're saying is a very fast skills escalator. Get on that escalator. But if you've already reached the top, you already have a master's degree, the job market is extremely unpredictable. Get a job that allows you to grow and develop in a direction that you hadn't done before. So get a job that takes you into management and leadership. That's a start. Get a job that leads you into health and safety, for example. And then from there on, you're already in health and social care. So navigate your own career, just take control of it. But remember, you've got people you know, networks that you can use, and use what you have. Don't wait for an online website to show you where your next job is going. Plan your way towards that. So I think, Mark, there are lots of questions in the chat that we have to take away as a workforce group and develop some more bite-sized sessions like this. But we're really grateful for the opportunity. Thanks so much, Sophie, for hosting this for us. And back to you, Sophie. Thank you.
No problem, and thank you, Muna and Mark. I thought that was a really good session, dead interesting, and I hope everyone benefited from joining. I will be sending an email out either later this afternoon or on Tuesday. It'll be a follow-up email with the slides and a link to the recording as well. So you can share that with your colleagues who were unable to attend. And yeah, just any feedback, or if anyone would like to also do a bite-sized session, please just send me an email and I can arrange that for you. Thanks again for taking the time to join. Sorry that it's ran over, but it was so interesting. We could have carried on, I think. Yeah, thanks everyone.
Thank you.
Thanks, Sophie.
Bye-bye.
Thanks.
Thank you. Bye.